Good morning, everybody. If you're watching this, you're either contemplating having a knee replacement or you've had one. So this is a follow-up to my video last week. So I'm 2 weeks and 2 days into when I had my operation. I did the first video last week after a week, and this is just a follow-up, just to let you know how the last week has gone for me. I've delayed it a couple of days due to the fact that I had a couple of hospital appointments. I had physio as well. So moving from my first video onto this next video, there's one thing that I've taken from it is that sometimes you can push yourself too much. And you're probably looking at me thinking, is he not had a shave again? Well, I put something out on Facebook to say that obviously shave or no shave, and it's no shave. People like it. So I'm not being scruffy, but I'll come to my next bit shortly. So anyway, yeah, the second video. There's one thing that you need to probably get psychologically into your head is that you can push yourself too far and then it pushes you back on getting fitter. An example of it was that I started to do a schedule of my exercises during a period of the daytime from like 10 o'clock till 4 o'clock every 2 hours. Set myself targets of 10 of each, of 5 different exercises. And then the next day, the first day that I did it, the next day just totally wiped me out. So my advice would be, do some hard graft on one particular day, then take the next day off. But do try to keep moving, as in doing the exercises. I have like a plastic plate on the floor, so I'm working remotely for work. I have a plastic plate on the floor, on the tiled floor, and I use it, and I probably said it in the previous video, but that just keeps you moving. Get up. I've discussed walking. I'm only on one crutch now, which is really good. So my leg that I've had done is my left leg. And basically, I was doing it wrong with the crutch. So I had it, so this is my bad leg. I was having it like this. But having discussed it with a good friend of mine who's had hers done 2 weeks before me, it's always crutch in the opposite side. Basically, lead with a crutch and your bad leg. And then move on to your good leg. And then basically, once again, crutch forward as well as your bad leg, and apparently that is the best way to work it. So yeah, I've had physio last week. They were really impressed with my progression. I went past 90 degrees, and that was just over like 8 or 9 days, so they're really happy with that. And then in that time of 2 weeks and 2 days, I wasn't allowed to have a shower. They were advising me not to, because the worst thing that can happen to you, which will set you back, is getting an infection in a wound. And I was really conscious about that, and nervous about it, because it just sets you back once again. And I'm one of them people that can't sit still. I need to be on the go all the time, and it does get you frustrated. So I did what they said, and so last week I had my first physio. They were dead pleased with it. I'm struggling with getting my knee straight. So if you look down the front of me, it needs to be straight like the other one. But I'm only 2 weeks in, so I can't complain too much. Other thing is, so on 2 days ago, I went and had my stitches out, my staples out. There's about 30 odd of them. Took the dressing off that had been on there for over a couple of weeks. And it wasn't, people were saying it really hurts. I was okay with it. I didn't watch it. I had a nurse that just basically said, listen, get on that couch there, I'm going to do it, bang bang bang. I was like, is that it? She went, yeah. The initial sensation that you get is that it's really itchy, and you think as though your leg's going to fall off, because you've experienced your knee being very tight with those staples pulling everything in. And I get that. You're just a little bit cautious when you first get up. So I had to sit on the edge of the bed for a couple of minutes just to get my head around it all. She's very good, the nurse. And yeah, I got up, went out. She put a fresh dressing on it, by the way, and said, listen, don't have a shower today. Leave it for 24 hours. I'm thinking, God, I want a shower. So I left it, and yesterday was my first shower. We've got a stand-up shower. All I would advise you to do is that obviously you've got to take the dressing off before you get in. Now this stuff here, which is it's called a peel, and this helps if you're struggling to get. This is what my wife got from work because she is a nurse. It's an adhesive remover, and it basically helps you take the dressing off without any stinging or any discomfort. I didn't use it because my wife's a bit, because my wife is like, get on with it, pull the bottom up and then straight off like a wax strip. So yeah, she has no sympathy, but then again, if you don't expect it, you just get on with it. And another thing as well, if you're getting a stand-up shower like we've got, make sure you've got a non-slip mat on the bottom. But yeah, it was a really weird feeling. Obviously getting water on it for the first time, looking at it, I'm thinking, if I bend my knee anymore, it's going to just open up like a cake. And yeah, we're about 12 hours in now, and it looks a bit, I'll show you now. I think you can see it there. So yeah, it just looks a little bit, there's still a lot of swelling. I'm getting a lot of swelling down to my ankle area and to my calf. And that's restricting quite a lot of the movement. But I'm trying my best. I'm not overdoing it. I live about, how far would you say? I live around about 750 metres away from the hospital. I've got my next physio this morning. And I do walk there just to push myself. And it's amazing the amount of people that you speak to that have had it done and said you'll get there, but I want results straight away. But this is something that you can't do straight away. One thing that I find is trying to put a sock on. That's been it's quite a lot of discomfort, because basically what you're doing is, that's your knee, but you're trying to turn it to try and get your leg up. And the pain, I've not really had any pain as in from the operation, but obviously the movement that I'm doing that is different to just a normal knee going forward and backwards. Yeah, it does hurt. But onwards and upwards, I'm getting there. I'll do another video next week, let you know. But basically, it's keeping up the exercises. Do a bit of a schedule, but don't overdo it. I'm overdoing it because I'm frustrated, I'm eager, I want to get back to my business, but you've got to look after yourself. So myself and my good friend Carly are going out for lunch this afternoon after our physio, because we've both had our knee done. So she's 2 weeks further on than me, but we had a FaceTime yesterday. She told me that I'm doing probably better than what she's doing. We're going to go out and just have a chat this afternoon. But yeah, if you are watching this and you are contemplating, or you have had it done, contemplating, it's a definite yes. You've got to go for it. But make sure you know how you want to be put to sleep, what the risks are. And, you know, I, as a surgeon, got a good track record. For me, it was a no-brainer, really. It was a week's notice, get on with it, crack on. You know, I'm only 55 and I want to enjoy a little bit more time and being able to walk with my missus and not having to lag behind and miss out on a pint when I get to the pub. That's a good thing. Anyway, take care, everybody. And if you're watching it, best of luck. You can drop me a message if you've got any questions. But yeah, it's all part of trying to help other people. And that's what I like to do. Take care. All the best. Bye-bye.